Yeah, so I'm the last man standing between you and the lunch. So I'll try to make it as interesting as possible. So I'll be delivering my talk on advanced imaging in retinal practice, a comprehensive guide. So as we know, I think retinal imaging provides very good insights into the structure of the retina and all other posterior segment anatomy. And I think the one very unique part is we are able to visualize and monitor all these blood vasculatures unlike any other body part. And it can actually reflect any of the systemic abnormalities and which may help us to early detection of many of the systemic disorders like diabetic retinopathy, like Alzheimer's disease and all these things. So my focus area of my talk would be on ultra-wide field imaging in retina, and subsequently I'll be speaking a bit on OCT angiography. So mine would be more of a case-based discussion and how these imaging is helping us change our action plan in the management of all these disorders. So before we go into that, just a little bit of history. So this is on the right-hand side what we see. This is the first image of the retina that has been captured way back in 1884. 140 years ago. So this what we see is a reflex of the cornea, and here is the optic nerve. And these are the blood vessels that were faintly captured, and the exposure time during that period was 2.5 minutes. So this had to be on for 2.5 minutes, and then this image was captured. And circa 2024, now we go. So this is the standard posterior pole fundus photography that we are seeing right now. Of the beautifully, we can see the disc, the blood vessels, and everything. So there is increased advances that is happening in the quantum of imaging of the retina that is happening. So when we talk about posterior pole, it is a central 35 to 50 degrees of the retina that is there, that is just up to the arcades. Wide field imaging includes extending from 60 to 100 degrees. So we are able to see up to the posterior edge of the vortex vein ampulla. And far periphery, that is ultra-wide field, involves anything beyond 110 degrees. So we can see beyond the anterior edge of the vortex vein ampulla and maybe even up to the pars plana, depending on what quadrant are we imaging. So how does it actually appear? So this is just a case of a retinal detachment, and this is a posterior pole photography. So this dark area, what we see is the detached part of the retina, and here we can see the macula. So it's a standard 50-degree photography. So when we compare it to the wide field imaging, this is 110 degree. So here we can see more amount of detached retina. And then when we go to ultra wide field imaging, this is what we actually see on an ultra wide field. So the extent of the retinal detachment is beautifully demonstrated in this. And in addition, we can